Hi, this is Sharon Pollia. Today we're going to talk about documentation on an EMR. Specifically, I'm going to show you some ways to document on OpenEMR, the software that I know you all have access to. This is course EMR, and this is Module 5, documentation of an OpenEMR, and this is part 1. I broke it up into 2 parts because there's a lot to discuss. I'd like to start by discussing what actually we are going to be documenting on. There's many things to document on within the electronic medical record. For instance, medical issues, medications, immunizations, vital signs. These are all important items that we need to collect data on and to review. Continuing on what we document on, I'd like to discuss a few items. For instance, medical history. It's important to capture a patient's medical history. Additionally, their surgical history, any procedures they may have had which may impact their current care, as well as their family history. It's important to see, what the family history is. Another thing we document on is the review of symptoms. What's wrong with the patient, what we need to capture there, typical of what you would discuss with your physician when you went for an office visit. So this is where a physician would document. Actually, it's another way to say their documentation. It stands for Subjective Objective Assessment Plan. So subjectively, what is the patient stating is wrong? What are the doctor's opinions? What's wrong based on data, lab test results, assessing what needs to be done, and planning forward how to proceed. Patient notes, again, these are another form of documentation that's collected and sometimes sent to other physicians. And as well, we document on referrals, if a referral is needed, or if in fact this patient came through as a referral. So just how do we document on a patient? I'll discuss how we do it in OpenEMR, which is the software that we'll be reviewing through this course. But it's very similar within any of the EMRs that are out there today. So before you document, you need to choose a patient and open their encounter. So each patient has a medical record that is for them, and then each time they visit a physician or a specialist, that's called an encounter. So to create an encounter, you have to click on the patient, you click on visits, and you open up a new encounter form. On this new encounter form, you're going to enter all the information: a brief description of why the patient's there, the category of visit, whether it's a new patient, an established patient. I know we discussed this previously when we did scheduling. We're also going to add any issues that may appear for this patient, problem, why is the patient here, any allergies that the patient has, any medication the patient may be on, previous surgeries, even dental history. It's important to collect all this information as well as document on it so that we can review it later on. So as I mentioned before we can actually document on a patient, we need to have created a record for the patient. So let's review how to create a new patient. Again, I'm doing this demonstration within OpenEMR. Some of the screens should look familiar to you. So in the top left corner, we're going to click the button that says New Patient. Under that, you will see, once we created the new patient, where we did the search for the patient's name and any other demographic data we entered would have been pulled in at this point. If we want to edit the information, we would click under that where it says Edit, under next to it where it says Demographics, and the demographic screen would come up. I'll get to that in a minute. So basically we need to just determine whether it's a new patient or an existing patient. We first search to see if it's an existing patient. If none exist, we create a new patient. So as I mentioned, before we actually see a patient and document on a patient and assess a patient, we need to know more about the patient. So we're going to enter data on the screens as necessary. So first thing we're going to do is enter demographic data. Once we determined the patient was new or existing, we clicked on the Edit tab next to the word demographic, and again the screen should look familiar. The demographic screen pops up, and as I mentioned, any data we have entered will come across the name. If we entered a date of birth and sex, here we would also enter their social security number, their marital status, and we would click through the tabs, and enter the contact information, the communication information, the employer information, any statistical information. We would also go down to the bottom half of the screen and enter the insurance information, very important. And continuing on the demographic screen, as I mentioned, one of the tabs is the communication preferences. This is very important. It's important to be able to communicate with the physician, with the patient. So here we capture the provider. We also capture the referring provider. Often we need to send information back to the referring provider. And we want to be able to capture the ability to allow for voice messages, if the patient is willing to receive emails, if they're willing to share immunization data, health information exchange, and if they're interested in setting up a patient portal. We also need to capture the HIPAA release. As I mentioned before, this is all very important information that needs to be not only collected but documented on. Moving along within the demographic information, we also need to capture employer information, what the employee's occupation is, and what the actual patient's occupation is, who they work for, their address. This is also important, obviously, for insurance information. Often the patient is insured through their employer or through their spouse's or relative employer, so it's very important to capture all this information. And again, to document within the demographic screen, again, it's important that we capture all this information. We're now following along to the statistics tab and collecting any statistical data. As I said, we need to report on this data for meaningful use and to other reporting agencies. So here's where we capture the language, ethnicity, race, family, how they're living, and their living conditions. And again, as far as documenting, it's very important to capture not only current information, but once we know it, it's important to capture miscellaneous information such as deceased data. It's important to know when the patient died and the reason, so that we can report on this, and also for ethical reasons, you don't want to send communication to deceased patients. And lastly, on the demographic portion of the documentation, it's very important to capture insurance information. Very important for billing, for a lot of reasons. It's important that this information is accurate. So it's important to capture not only the primary insurer's name and their relationship, but it's important to get the policy, the plan, policy number, the group number, again, if it's self or relationship to the insured person. Here we can also enter not just the primary insurance, but many people today also have a secondary insurance and even a tertiary insurance. So that's where all this information is contained. Again, we will continue on with this documentation portion of the module. In the next module, I just wanted to give you a basis on capturing all the demographic information.